I want to ask you first very briefly about the consultation process. Very simply, in your view, was it a fair process?
In my view, it was not a fair process.
Can you explain why not?
Yes, I can. When the process first started, I went to a public meeting at Ealing Town Hall in, I think it was 2011, and I was assured by one of the senior representatives of NHS, the North West London, as he then was, that this was to be a proper consultation and that no decisions would be taken without the consultation and consent of the local people.
Could you pause there for a moment? Entirely my fault. I forgot to ask you, as you are, I believe, a member of a board member of Health Watch Ealing, is that correct?
I am board member and trustee.
So please do go on. You were telling us about why you felt the consultation was unfair.
Basically, because the reassurances I was given at that stage did not come to fruition. I saw very little difference, if any difference, between what was initially proposed and what finally came from the result of the consultation. So I'm sorry, but I was not particularly happy with the result, and I do not believe it took into account a lot of the evidence of the.
And in terms of the publicity given to the consultation process and its accessibility by members of the public, was that done correctly or not?
I wouldn't say it was done incorrectly. I might say it might have been done better. There was the provision for written submissions to be made, and I presume in that case it probably was done reasonably.
Are you able to help with whether or not it reached all sectors of the population?
I very much do.
And are you able to help, and maybe I don't know which sectors of the population it didn't reach?
I don't think it would have reached people who live in places where I now have to live in sheltered accommodation, where very little information gets through to the elderly and disabled in the borough, unless they actually get the local paper or try and find out themselves. There's very little information that comes through.
Now I want to ask you about the impact on the closures so far. Now we know, of course, that Central Middlesex and Hammersmith have had their A&E departments closed. Can you help us with your view of what impact that has had on you personally and on people in the locality that you know?
Yes. The impact on me personally is that I have witnessed at Ealing Hospital A&E a large growth in attendance, lots more pressure on staff. I had to attend there, unfortunately, in October of last year, spent most of the night there, and I could see the pressure that everyone was under. And I can presume that a lot of that is down to the fact that people cannot go to places that have been closed.
And had you used that facility previously?
Yes, I have.
Before the closures?
Yes, I have.
And was it the same or different?
It was more busy this time.
So what do you say the likely impact, or in fact the impact thus far, of the closures of the other A&Es has had on Ealing?
I think it's had a very detrimental effect. I've been advised by staff at Ealing Hospital now that if I was to be taken ill at my home in Ealing, or if I was to be involved in a serious road traffic accident in Ealing, my chances of getting treatment quickly and locally are much reduced.
And is that predicated on the basis that Ealing's A&E department is to be closed or changed in structure?
I'm very wary of that happening.
Tell us what you think the impact will be if that department closes or is downgraded.
To me, it will be a nightmare because we also have the news coming through that Ealing Hospital itself may well be down for closure, and that will mean there will be no inpatient beds left in the whole of the London Borough of Ealing, and patients will have to travel a long way, will be taken a long way in order to make some very difficult journeys in order to go and see their families.
What's your understanding of where patients will go in those circumstances?
My understanding is that Northwood Park either has been or is due to be expanded in some way. Northwood Park is a long way away. It could take up to an hour in a rush hour to get there from where I live. I've also been told that there might be other expansions that I think Ealing was mentioned. Again, that's a long way away.
Now, you raised concerns about fragmentation of services and about the possibility of records not being properly shared between different treating clinicians. Is that something from your own personal knowledge?
It is from my own very recent personal experience, only in the last couple of weeks, actually.
Is that something you'd be prepared to share with the Commission?
Yes, of course.
Please do.
I was referred by the consultant urologist at Ealing Hospital for tenders of the second opinion at Charing Cross Hospital. I attended to see the consultant at Charing Cross, who then made the appointment for me to attend again for some tests to be carried out, and I spent most of the day there. When I had my follow-up consultation at Ealing, the practitioner, the consultant at Ealing, had no access at all to the results of those tests that were carried out at Charing Cross. And that was over a period of about a month.
Now, you may or may not be able to help with this. To your knowledge, is that something that you just know in terms of yourself, or are you aware of it's happening to other people?
I've not discussed it with other people.
Now, you have a particular interest, you say, in transport. Can you help us with your view of the transport advisory groups that have been set up? Do you know what their role is and whether or not they're effective?
I've heard little or very little or nothing about them. I really don't know much about them at all.
So on the ground, in terms of transport between hospitals, are you able to help with what actually happens now? Perhaps if you take it in two stages. In terms of a non-emergency situation that requires some form of hospital transport, what is it you say happens?
Well, that is my experience, is non-emergency. Although I've had emergency transport in the past, my main concern is on non-emergency transport. I have to attend, at the moment, 3 different locations, Ealing, Charing Cross and Claypons in Ealing, and I use patient transport, non-emergency, for all the appointments that I have. And at the moment, I'm roughly running at about 1 every week to 10 days. Any of those.
Is patient transport provided when it's needed?
It is provided. My concern is the style of transport, the qualification of the staff who run the transport, and the timing of the transport. Those are my 3 key areas where it goes wrong.
Perhaps we take them each in turn.
Sure.
Start with the first one and tell us what your concerns are about that.
My concern for the vehicles provided, if it's albeit manned by private sector people, if it's a NHS branded patient transport, purpose-built vehicle, then that seems to be okay. But on many occasions, my hospital transport is passed out to a local minicab firm, which for me, being partially disabled, is very difficult when their main priority, their driver's priority, is to get the job done and be back on the road as quickly as possible. So patients can run thin with the driver if I have difficulties. They're not kitted out like a proper passenger ambulance. The drivers are not trained how they deal with anything urgent or emergency in transit. I really don't know. I'm not sure they don't. And for timing, it's a matter of whether you get to your appointment on time or not. I've had several cases where I've been picked up late. I always have to be ready 2 hours prior to my appointment, which I always am. I'm always ready in time. But if I'm not picked up until about the time of my appointment, I can be half an hour, 3/4 of an hour late getting to the hospital and to the clinic. There was one occasion closed, so I couldn't be seen that day and had to be sent home again.
Do you know who decides, who makes the decision about whether a particular patient is to be sent in hospital transport or contracted ambulance?
Hospital transport initially is arranged by my GP. If I have to attend a new clinic for the first time, that has to be organised by the GP, and the GP contacts the hospital transport people and it's fixed up from there. If it's for a repeat appointment with the same clinic, I can just book that, or it should be with the hospital transport people automatically anyway.
But in terms of whether what is sent to you is an in-house vehicle or a private vehicle?
Oh, I really don't know. I have no control. I said in my submission that I find hospital transport a lottery, and I chose that word very carefully because in the lottery you can win, you can have a very good experience, but also you can have a very bad experience.
And just thinking about the way things have evolved over time, are you able to say whether the transportation system is still as it used to be, better, worse? How are things, what direction are things moving?
It's getting worse. Most of the hospital transport, in fact almost all hospital transport now, I believe, even if the vehicles carry the NHS logo, are run by private companies. And on that basis, I'm afraid it seems that finance comes before patient care.
And are you concerned, do you have concerns about risk involved?
I have concerns about risk involved when there are non-trained drivers in minicabs. If I can give you one example when there was a severe risk, quite recently, yes, and this was, I'd been to Charing Cross for an appointment. For transport home, I was put in a normal saloon car, it was from a cab company, with my walking frame, which they had great difficulty finding room for in the vehicle. I was then joined by two other patients, both with large sets of crutches. One of the patients had just been discharged after a knee operation, and there was just no room in the vehicle for her to be comfortable stretching her leg. There was no room for the seat to be moved because the three of us were packed in the back of this vehicle. I'm sorry, that to me is a big risk.
I wanted to ask you now a little bit about your role with Health Watch Ealing.
Yes.
Could you have a look, please? There's another bundle there, and it's headed Volume 2. I wonder if you could please turn to page 673.